Good morning and welcome. And thank you very much for joining us in today's very first technical briefing on health and climate change in the health debate. My name is Ian Hamilton. I am the Executive Director of the Lancet Countdown on Health and Climate Change and a Professor of Energy, Environment and Health at University College London. And today I'll be the moderator of this technical session. To first say, in 2015, the Lancet Countdown on Health and Climate Change concluded that anthropogenic climate change threatens to undermine the past 50 years of gains in public health, but that tackling climate change could be the greatest health opportunity of the 21st century. And each year since 2015, the countdown has tracked the world as it moves from seeing climate change as a threat to human health to its response as an opportunity for human health. What I'd like to do is first outline today in terms of the aims and objectives of this technical session. And to first say that the aim overall is to be able to raise the debate and inform the WHO Regional Committee for Europe delegates on recent global and regional developments on climate change and health, and provide an opportunity to discuss the challenges and opportunities ahead. So in the technical briefing, we're hoping to be raising the awareness on the significance of climate change and its impacts on health, to be able to update on the state's preparations in advance of the COP26 Conference of the Parties, and of course, to inform around the synergies and co-benefits of tackling air pollution and climate change mitigation, highlighting opportunities of strengthening the role of the health sector in tackling climate change, both in terms of adaptation and mitigation, and reinforcing the commitment to create climate resilient, environmentally sustainable health systems as being a key part of achieving universal health coverage. So in this first part, what I'd like to do is also give you the groundwork of how we'll be running today's technical session. And we have a great lineup of speakers that are in the program and we'll be going through for the rest of the morning. But also to say that we will have an opportunity for people to place questions. For those who are joining via the Zoom, then please do use the Zoom meeting chat, and we will be able to do our best to follow those up live. But for those of you who are joining us via the live stream, if you could use Twitter and use a hashtag of RC71, that would allow us to be able to track questions and comments that come through, and again, be able to address those later on in the session. What I'd also like to do is, in the slide that we have, is highlight the technical briefing and a report that was put together from the last session, which is on zero regrets. And this framing of zero regrets that came out very recently as a key messages from the working group on health and climate change. And what this report does is bring forward the issues that were discussed as a part of that forum and the recommendations and messages to be able to bring forward to the rest of the group. And to note for those who are joining in the Zoom session that that link is being placed in the chat available for you to download and read at your opportunity. I'd also like to say that as a part of the activities and engagement in the session, we'll have some Slido polling. And here, what I'd like to do is invite you to open a browser or use a mobile phone and either type in Slido and go to that address, or use your camera and the QR code here and follow that. You can access the poll with the hashtag of Klima at the top of the screen, and that'll be an opportunity for us to hear from you and also be able to comment on some of those inputs that you have in terms of this issue. So in the first instance, what I'd like to do today is welcome Dr. Hans Klug, the WHO Regional Director for Europe, to address the meeting participants and to provide an opening comment. Please, Hans, the floor is yours.
Thank you very much, Ian. And good morning, good afternoon, everyone. Welcome to this briefing, which for the very first time in the history of the WHO Europe Regional Committee briefings and in general the RCs brings climate change to the table of the member states. Why now? Because the climate crisis is a health crisis. The changes observed are unprecedented in thousands of years, as shown by the report of the Intergovernmental Panel on Climate Change released last month. And let me show you what this means. Now we will go to Slido. So please just answer the following question using the Slido login that is displayed on the screen. And here we go. So the question is, have you or someone close to you experienced any of the following extreme events? Flooding, heat wave, wildfire. And I'm filling it myself now. There we go. Colleagues, in the near future, we will likely see an even higher number of you answering positively to the question. Nevertheless, it's evident. Climate change is not just happening far away to vulnerable groups or in a distant future. It's happening to everybody, every day, right here, right now. Only weeks ago, floods in Western Europe, the worst in a generation, left hundreds of people deceased and caused extensive damage to homes, property, and livelihoods with long-term impacts on mental health and well-being. Flooding is a health threat. In the first 8 months of 2021, 1,100 fires were registered in the European region, 300 more than the recent annual average total. Wildfires are a health threat. In Italy, a temperature of 48.8% Celsius was recorded this summer in Sicily, what is believed to be a new European record. So heat waves are a health threat. And we often assume that these events are extraordinary, but we must understand and prepare for them to become a part of our lives. Climate change is a health threat. No individual, no country is safe from the effects of climate change. It is a truly global challenge that requires an urgent response. Governments must substantially reduce their greenhouse gas emissions to prevent the catastrophic effects of 2 degrees Celsius of global warming. While it could take at least 3 decades to see global temperatures stabilize, in response to these reductions, there would be immediate health benefits thanks to reductions in air pollution, currently causing more than 500,000 deaths in the European region alone a year. Next week, we'll see the launch of the updated WHO Global Air Quality Guidelines, a scientifically robust health tool to assist governments in addressing air pollution, a tool in the global fight against climate change. And I'm very proud of the leadership of Francesco Racioppi, in charge of the Bonn office, a center of excellence really on environment and health, and congratulations to our whole team who pulled off those updated guidelines together with WHO headquarters, the team of Dr. Marianera. Let us also talk about the health sector. Climate change is squarely our business and requires a coordinated response beyond emergency management. The climate change puts overwhelming pressure on our health systems, and it drives the spread of vectors and pathogens to new areas. It affects mental health. The Member States of the Regional Committee just adopted a new European framework for action on mental health. Very timely, because the climate change affects mental health due to natural disasters, threatens livelihoods, exacerbates non-communicable diseases, causes injuries and malnutrition. And as we have seen these past 2 years, the impact on health system capacity can be dramatic when health systems are simultaneously to respond to a climate crisis and a pandemic. So we need to integrate and institutionalize climate change into our health systems agenda to make them climate fit for the future. The UN Climate Change Conference in Glasgow in November will be an opportunity to take the global plan of climate action to a whole different level. The UK presidency, with WHO support, has launched the COP26 health programme with 3 clear commitments. First, to make our health systems climate resilient. Second, to make our health systems sustainable and low carbon. And third, to monitor these commitments. What gets monitored gets done. I join this call to all our European member states to sign up to the COP26 health programme and encourage all ministries of health to take an active role in the preparations for the COP26. I also welcome the initiative by the Working Group on Health and Climate Change of the European Environment and Health Task Force to equip policymakers with health arguments to support their active engagement domestically and at the COP26. In closing, let me echo one of them. I call upon you to strengthen the voice of the health sector and bring climate change on the public health agenda of your countries. And we stand together, united action for better health in this endeavor. And my appreciation to all of you again for joining is the first such technical session of today and tomorrow, and to all well-known speakers. Thank you so much.
Thank you very much, Hans, for those very powerful opening remarks and the way in which climate change and its impacts in our health is personalized, and in particular, how international action can yield local benefits to our health in terms of, for example, reduction in air pollution. And of course, that need for health systems to be resilient and provide future protection for our health. I would now like to invite Professor Sir Andrew Haynes from the Centre on Climate Change and Planetary Health from the London School of Hygiene and Tropical Medicine, and also to highlight the WHO Europe and that longstanding collaboration with LSHTM as one of its key advisors in the field of this work, and also the recent collaborating appointment for the WHO Collaborating Centre on Climate Change. And so thank you, and the floor is yours, Andy.
Thank you very much, Ian, for the introduction. And let me build on the words of Hans Klug and Ian in his introductory remarks to emphasize the importance of climate change for health now and in the future. Could you show the first slide, please? So climate change is with us right away. We know that already the global average temperature has gone up by 1.1 degrees, something of that order, since as a result of climate greenhouse gas emissions from human activities, primarily the burning of fossil fuels. I'm still not seeing the slides. I don't know if you are, Ian, but no. So if someone...
I think these will be put up momentarily.
Okay. So the climate change that we're already experiencing is having effects on our health right now. A recent paper, for example, based on data from over 700 sites in 43 countries, showed that over 1/3 of the heat-related deaths over recent decades could be attributed to human-induced climate change. As you can see from this first slide, the temperature increase is not uniform. It's higher over land than over the oceans, and some parts of the world are heating up more quickly than others. You can see from the slide, for example, that the Arctic region, Northern Europe, is heating up more quickly than the rest of the planet. And this, of course, will melt and is indeed already melting ice caps. And as the snow and ice retreat, that, of course, accelerates climate change. And the danger is, of course, for as we heat up the tundra, that we get the release of methane, which is a powerful greenhouse gas and could accelerate global warming even faster. So as we increase the temperature on our planet, there are rising risks. Those risks can be mediated through ecosystems. Ecosystems can't keep pace with the change of climate change, the change in temperature. Extreme weather events, we've already heard, floods, droughts, wildfires, extreme storms. The potential for ice sheet collapse, the die-off of coral reefs, which is already happening. The Arctic region, as I've mentioned, is heating up more quickly than the rest of the planet. And we're seeing increases in coastal and river flooding. And these all have implications for human health, for example, through reductions in crop yields and increased heat-related morbidity and mortality. Next. So there are multiple mechanisms and multiple pathways by which climate change has impacts on human health. The increasing levels of carbon dioxide and the short-lived climate pollutants like methane, black carbon, and tropospheric ozone all contribute to the rising temperatures, the rising sea levels, and other impacts. And mediated through a whole range of socioeconomic and other environmental factors, these have a range of effects on human health. They range from the most direct, extreme weather events and heat stress that we've already heard about, through the less direct, air quality as a result of wildfires, for example, or increases in tropospheric ozone, effects on water quality and quantity, and food supply and safety, and of course on vector-borne diseases, on vector distribution and ecology. And finally, those group of impacts that are most difficult to quantify, but may turn out to be the most important, and that is the effects of potentially forced migration, the effects of socioeconomic disruption, increasing numbers of people being pushed back into poverty, and possibly conflict as well. So you can see that there are complex pathways by which climate change affects human health, both physical health and of course mental health, as we've already heard. Next slide. So we have to respond in order to reduce the risks of dangerous climate change. We have to adapt to some degree because we can't prevent all climate change. We've already reached over 1 degree heating. But we can adapt by having more resilient health systems, better early warning systems for heat waves and for other extreme events or disease outbreaks. We can create more robust supply chains and so on. So we must adapt, but adaptation is not sufficient. We won't be able to adapt to all the effects. There will be limits to adaptation. When we reach the limits of adaptation, things will get worse much more quickly. So we have to mitigate, we have to cut emissions. And as we've heard, in doing so, we can also benefit health in the near term. So over and above the benefits of reducing dangerous climate change, we can also reduce many of the risks to non-communicable disease, for example, that are posed by our current patterns of living. Next slide. So in order to create climate resilient health systems, we need to address the different building blocks of health systems, which are summarized in this slide. I won't read them all out. But what you can see is that we need to develop better capacity to assess the risks, to develop integrated risk and early monitoring and early warning systems, to support health and climate research, which has been greatly deprived of resources, to create more resilient supply chains, and to enable us to sustain our healthcare delivery systems in the face of climate shocks. But we have to do more than just create resilient health systems. We also have to rapidly reduce the environmental footprint of health systems, as we've heard. So health systems globally are responsible for about 5% of greenhouse gas emissions, something of that order. If they were a country, they would be the 5th biggest emitter in the world. So the healthcare system has to take the lead and decarbonize its own supply chains, move towards the use of renewable energy, and work with sectors such as the pharmaceutical industry, the medical equipment industry, to incentivize them to decarbonize their supply chains so that we can move rapidly to a net zero, climate resilient health system in Europe and worldwide. Next slide. There are many healthcare benefits of a low carbon economy. We've already heard about some of them. Our transport systems are inefficient. They pollute and they drive carbon dioxide into the atmosphere, which directly harms the environment, of course, and our health. We can say the same of our energy and our food systems. The livestock sector, for example, is responsible for significant greenhouse gas emissions. About 30% of emissions come from the food system. And the transport system, likewise, is a major contributor to greenhouse gases. But it also promotes a sedentary lifestyle and exposes us to large amounts of air pollution. So there's lots that we can do in addressing these different sectoral emitters of greenhouse gases that are also responsible for large burdens of disease right now. So as we move towards a zero carbon economy, we can reduce the risks of dangerous climate change and also benefit our health in the near term. Next slide, please. Just to give you one example, you've already heard the headline figure here, but we estimate about 3.6 million premature deaths annually from ambient air pollution from fossil fuels. That's from fossil fuel burning, coal, oil, and other fossil fuels. About 430,000 of these are in Western Europe. If we add the Russian Federation in, then as we've heard, it comes to over 500,000 premature deaths. So if we move towards clean, renewable energy, then we not only reduce greenhouse gas emissions, we also prevent in the near term these deaths. These deaths are due to heart disease, chronic obstructive pulmonary disease, some types of cancer, and diabetes and other common conditions. So these will greatly reduce the burden of non-communicable diseases. Next slide. So you can see that there are many opportunities really to emphasize the importance of health in both adapting to climate change and, very importantly, in cutting greenhouse gas emissions. And as we've heard, COP26 is a great opportunity for health. Each country that signs up to the Paris Agreement has committed these nationally determined contributions. In many cases, these don't make very specific reference to health. But WHO is doing a great deal of work with countries to ensure that when they submit their nationally determined contributions under the Paris Agreement, that there's a strong emphasis on health, not just the adaptation to climate change to reduce the impacts on health, but also the benefits that I briefly alluded to, the co-benefits of moving towards a zero carbon economy. There's also opportunities through national adaptation plans. Far too little of adaptation funding goes into supporting health. The evidence base is still fragmented, but there's a lot that we can do to increase the resilience of healthcare systems, as I've emphasized. Climate finance all too often overlooks the importance of health. So we do need to work with the Green Climate Fund and other sources of climate finance to make sure that the investments that they make not only accelerate the transition to the net zero economy, but also improve health. Immediately after this conference, I'm going on to a conference of lawyers because there's now a groundswell of activity with the legal community. And you can see on the right side of this slide, there's a summary recently of all the climate change litigation that's going on in the world. And increasingly, the legal professions are looking towards health professionals to provide the evidence that will help in this climate change litigation. We're also extensively working with city leaders, local government leaders, and in many cases, there's a lot of activity going on at the subnational level to decarbonize cities and to create more resilient urban living opportunities. And finally, as we've heard, there's a real opportunity now for the health system to show leadership by moving towards net zero emissions. NHS England has now committed to net zero emissions by 2040 for direct emissions, and by 2045 for the indirect emissions from supply chains. And I'm optimistic that many other healthcare systems will follow over coming months and years with a similar sorts of commitments. So we are at a very dangerous point in human history. As we know, we're living in the middle of this climate emergency now. It's just beginning. It will get worse as time goes on. But it depends very much on the decisions we make over coming months and years. So I'm confident that the healthcare professionals and WHO will play a leading role in urging us to move very rapidly towards a healthy, net zero, climate resilient economy. Thank you very much.
Thank you very much, Andy. I would like to take the opportunity to also invite Dr. Hans Klug to make a statement as well.
Thank you, Ian. I wanted to thank you, Professor Haynes, dear Andrew, for your contribution. Because I remember very well, we were together at the ministerial conference in Ostrava. At that time, I was the Director of Health Systems, and Andrew and me and Francesca and Bettina Mene, right? We were on the forefront of environmental sustainable health systems. So I just wanted to point out, Andrew, you see that we remain committed. I remember I was very proud to be with the very famous Professor Haynes in Ostrava. And I can tell you, I feel as proud as the regional director to be together. And I'm looking forward to the next very renowned speaker. So thank you so much, Andrew, and please continue to support our team.
Thank you very much, Hans. What I'd like to now do is take the opportunity to invite Dr. Hans Grunick, who is the Executive Director of the European Environment Agency, and again, to also highlight the WHO Europe and the EEA, who have worked together in partnership, along with a number of contributors on the European Climate and Health Observatory, and with the European Commission and other organizations, including the Lancet Countdown. So I'd like to invite now Hans, please. The floor is yours.
Thank you, Ian. Good morning, all. It's a pleasure to be with you. If anything else, this is a topic that really requires increased attention. And I think Professor Haynes has already pointed out a lot of things, and I will build on those, but make an explicit link to policy initiatives at the European level, the region that you are discussing today when it comes to this link. I'd like to say that for all the good reasons, the work of the IPCC in the last report is more explicitly focusing on the societal context that is impacted by climate change and on the idea of fundamental systemic responses and transitions to that context. And I think the debate that you're having today is part of that discussion. Now, the bad news is that we can coin the times that we have ahead of us as the age of loss and damage. This was a sort of concept that was used in climate negotiations, especially by developing countries, to say that they are suffering and have the largest loss and damage and are not responsible. But I think by now we understand that we're all living in a sort of age of loss and damage, loss of human health, damage to our society, and we need to contain this. Yeah. And the current promises, the NDCs of the countries under the Paris Agreement are falling far short of where we ought to be if we want to stay well below 2 degrees. So indeed, the COP in Glasgow will be really important to increase the ambition levels. We have been working in the European Environment Agency on what we call work on climate change impacts and vulnerabilities, and also on disaster risk reduction, and those are linked to your discussion today. I will not dwell too long on the fact that we're not only talking about temperature increases or stable cold waves, not heat waves. We're also talking about changes in precipitation and humidity, other extreme events like forest fires, hurricanes. That is by now all well known. I would also like to emphasize that there are long-term impacts on the physical environment that are not measured with peaks, but that are slowly changing patterns that have an impact on health issues. I think it's clear that Professor Haynes has referred to what we would call direct risks to health, heat waves, extreme cold, flooding, long-term risks to health, referring to vectors of disease that are shifting, food and waterborne diseases, but also I would like to emphasize impact on mental health issues. I think we underestimate that. So that would be a point of attention. And then especially also those effects on groups that have higher vulnerability, like the elderly or young children, poorer households. So those are important elements. Now, moving to the policy setting. It's all well known to you, I assume, that Europe is operating under a European Green Deal that is announcing that we will be the first climate neutral continent with net zero emissions by 2050. But also part of that Green Deal is a zero pollution target. And I think that's important when it comes to health for obvious reasons. There is an explicit link to health when it comes to a variety of initiatives, including farm to fork. There is for the first time a really strong and explicit desire to include the concept of social justice in the transitions that we will need to go through. And I think this is extremely relevant for your debate on climate and health and environment in a broader context. And I would say that across the whole package, there is a suggested increased integration between climate action, environment, and human health and well-being. Yeah? And that is mostly reflected also in indeed the adaptation strategy, which we see now in its new form. We adopted in Europe the new adaptation strategy. A couple of things to say about that. First of all, most, if not all countries in Europe by now have national adaptation strategies and plans. A recent analysis that we did shows, however, that implementation is often rather weak, that concrete financial commitments to parts of that planning and strategy are not very well done and transparently done, that there are serious knowledge gaps when it comes to implementing parts of climate adaptation, and that although it is mentioned, the implication, the involvement of public health professionals tends to be rather low. So I think it's important to emphasize that point. It's also important to emphasize that a lot of the initiatives remain in the domain of spatial planning, urban design, and environment departments. And so that the spillover into elements of public health policies remain rather weak. Now, the recent adaptation strategy calls for smarter adaptation, informed by robust data and risk assessment tools. I think it's important that we extend those explicitly to health impacts and integrate those in the knowledge base. Faster adaptation, because we see the speed of climate change and the impact it has on society increasing. So I think we need to reflect on how we can upgrade, I would say, that connection between the climate community and the health community faster, not only at the sort of policy level, public health, but also down to your family doctor and other more specialized parts of the medical profession. It also talks about more systemic adaptation, which links all sorts of interventions going from fiscal policies, stopping environmentally harmful subsidies, but also thinking about infrastructure, for example, and how can we link that also to this debate on health. Now, to illustrate a little bit the role that we play in this, it's clear that the European Environment Agency is not doing this on its own. We have a relatively small group of people who are working together for a long time already with the World Health Organization Europe and the people working there on environment and health. This has been a very fruitful collaboration. And in terms of climate, it has been explicitly strengthened by the European Climate and Health Observatory, which was launched in March 21. This is co-led by the European Commission, DG Climat and Santé, and the European Environment Agency, and it involves a lot of partners that I see here on the list, going from the World Health Organization Europe, and I want to thank Hans. You seem to be from Belgium and named Hans, if you're leading at the European level in this field. I want to thank Hans for the commitment there, but also we work together with ECDC, with the Food Safety Authority, with Copernicus, which allows us to integrate data of a different kind, and of course with the Lancet Countdown. So Ian, thanks also for the commitment there. What we aim to do is to pull relevant work and expertise across actors that have often worked in their own silo or at least fragmented, also in science. This is all about connecting knowledge and getting more out of it, making that knowledge better available to policymakers at a variety of levels in a multi-level governance perspective. Also raise awareness, because I think there is rather low awareness on some parts of impacts and vulnerabilities and then potential responses. And we want to also develop concrete expertise and tools and resources that can be used by those who want to do things. Some of the concrete adaptation solutions that we want to connect this knowledge to include better early warning systems on extreme events driven or caused by climate change and health. There is a potential there that is underused, we think, and that can be better developed. More concrete heat action plans that organize the response of a variety of stakeholders. Equipping over time, also with this type of knowledge, health and social care professionals in a better way, and that includes also the training of healthcare professionals. There is very, very little attention for environment and health, preventative medicine, and this type of connection in the education of healthcare professionals in many places. Yeah. Facilities that would help people in extreme events, where especially those who are most vulnerable and don't have their own resources to go to and feel and be protected, actually. And also better surveillance of climate-sensitive infectious disease, because the better we understand these connections, the better we can move forward. The last element is greening of cities, which is really important because most people live in cities and a lot of the adaptation takes place there. And I would like to emphasize, and that's my final sentence, what Dr. Haynes has already said, that we are focusing here on adaptation and on making those links, but actually strong mitigation is a precondition to make adaptation possible and feasible. Otherwise, the loss and damage will be really tremendous. And secondly, most everything we do on mitigation actually has very serious co-benefits for human health, on air quality, but also on biodiversity and other elements that contribute to human health. So I'm looking forward to continued cooperation with the World Health Organization, but also with the other partners involved. And we think that it's all about connecting the dots and getting more out of, until now, mostly fragmented knowledge bases to create better understanding and therefore better potential responses. Thank you.
Thank you very much, Hans. And I'd also, again, like to invite Dr. Hans Klug to make a follow-on statement.
Yes, to express appreciation to you, Hans. We had met already, right? We have Hans and Hans in Copenhagen. So I think this will be very fruitful for the collaboration, but we are genuinely committed. And sincerely, we are very, very happy how our strong complementary roles is adding evidence and robustness to the policies and decisions of our joint member states. So we're very much looking forward, as you were mentioning yourself, Hans, to work together under the Observatory on Climate Change, which you're hosting, very, very important, and to go together on the road forward. So thank you so much, Hans, and also to your team. Thank you.
Thank you very much, Hans. To all hands, I would like to now take the opportunity to invite Mr. Dave McConalogue from the Foreign, Commonwealth and Development Office at the United Kingdom, and who's going to speak about the drive for health at the COP26. And please, David, the floor is yours.
Thanks so much, Ian, and congratulations. I think you're the first person who's pronounced my name correctly without being coached before that, so that's great. No, it's really great to hear these presentations, and in many ways you've presented the argument so well, and I think Ian, Andy, and both Hans have really set us up to highlight what the importance of that relationship between health and climate change is, and it's because of those arguments that have been presented over many years but also I think because of the sharp focus that the pandemic has brought into on that relationship between nature, climate and health, that we're in a position, I think, for COP26 where we maybe have an opportunity that we've not had before. And so with that as a backdrop, health has been selected as one of the COP26 science priority areas. And this is really important because it gives a thematic focus to this that we can really use as something to drive forward for increased ambition. And I think there's probably three areas that we can use COP26 to drive forward for more ambition on health. I think the first one is to really using those health arguments and that health leadership to support much higher global ambition on mitigation and adaptation across the whole economy. So this is outside the health system, and really pushing for a higher level of commitment from countries. I think the second area is that actually most action for climate is also very positive for health. But what we also need to do is to bring forward that health voice to make sure as we progress with actions on climate, these are optimal as well for health. So we're maximizing those co-benefits for health and climate change and really bringing that argument to bear on those discussions. And then the third area is really about getting our own house in order. So if we're really going to show health leadership, we need to show that in how we develop our own health systems to be climate resilient and sustainable. But also, as Hans has mentioned before, is we need to elevate the voice of our health professionals and really get them to connect the relationship between climate change and health. But more importantly than that, for them to understand what their role is in terms of advancing and pushing for stronger action on climate change. So the COP26 health programme has loosely got 4 key initiatives within there, and I'll briefly cover those. What I would say when I discuss this is a lot of this is about obviously giving you information and trying to get you excited. And I think Ian, both Hans and Andy have really done that. But actually, there is also action here to come out of this. So absolutely sit and listen, but also there are a number of things here that you can take away back to your countries and governments and really push for change on. So with the 4 initiatives that the cover loosely, we're looking at health systems, health professional advocacies, and health adaptation research. The first 2 are related to the health system itself. And the first of those is around climate resilient health systems. I should probably, before I go into that in depth, I should probably also say that I'm here speaking obviously as a COP26 presidency, and we very much we've coordinated much of this work, but actually the work has been really developed and has been implemented by our partners as well. So we've got a really great set of partners within other countries, but also through WHO, UNFCCC High Level Climate Champions team, and Healthcare Without Harm. So the first initiative is around climate resilient health systems, so building climate resilient health systems. And this recognises that health systems are really critical in terms of protecting our populations, protecting the health of our populations from the impact of climate change, but are also incredibly vulnerable themselves to climate change. So when we need the health system to respond is actually the point where it's most likely to be compromised. So we also know that there is a lot more work to be done in terms of preparing our health systems for climate change, both for the risks that we have now and the risks that we're projected to have in the future. Around about 50% of countries have some sort of health national adaptation plan, and some of those are based on a systematic assessment of the vulnerability of the health system to climate change, but many are not. And we also know that levels of implementation are low. And potentially it's not the high political, it's not got the high political push behind it that it needs. So working with WHO, we're asking all countries to do 2 things. The first thing is to make a commitment to carry out a vulnerability and adaptation assessment. So this is a well-used tool, which essentially helps a country to identify where it's most vulnerable to climate change, both current and projected, and also to understand where it has adaptive capacity within the system and where there are gaps within that adaptive capacity. And then the second part of the commitment is for the country to also make a commitment to develop a health national adaptation plan, which lays out how it will address those vulnerabilities and those gaps in adaptive capacity moving forward to improve the resilience of its health system. And with this, and with the other commitment that we have on health systems, it's for the country to set the date for when they'll publish these, and that's important because we want it to align with their national adaptation planning process. So we don't want to set up a separate process and have it as a standalone plan. We want it to integrate within the national adaptation planning process. The second area on health systems around developing sustainable low carbon health systems. And I think Andy and others have already made the argument here, so I won't labor it. But there is a real role here for health systems to show that leadership in how they develop their systems to not contribute to the problems that we're actually trying to deal with and increasingly we'll be dealing with from climate change. And also their impact on local air pollution, which is absolutely critical for this as well. So we're asking all countries to do one thing, and that is for them to make a commitment to publish a plan by a date, again, a date of their choosing to align with their health sector reform planning processes, to develop a plan which sets out how they will develop a health system in a sustainable and low carbon way. And then the second element of this, although it's very much for the choice of the country and where this is appropriate, is for them to set a to set a target date for when the health sector will be net carbon zero. And this is in a similar way to the NHS in England have done this, and they've set a date to be net zero by 2040 for operations under their direct control, but to be completely net zero, including the supply chain, by 2045. But we also know from our engagement with other countries who are now starting to make these commitments that we have several other countries across low and middle income countries as well as high income countries who will be making similar commitments, which is really great to hear. The third area is around health professional advocacy. So again, this really recognises the fact that in most countries in the world, health professionals are the most credible and trusted profession. So it tends to be doctors, nurses, dentists, and then all the way down to professions which rank very low. I won't mention who they are, but you could probably have a guess. And I think the other really important thing is when we survey health professionals, generally they understand that there is a clear link between climate change and health. Where the gap tends to be is in terms of what it is they do about it, so what their role is. And so we're working with a group of non-government partners, and this is very much led and driven by them, and we're really supporting to elevate it through COP26. But they're going out on a campaign which is really about elevating the voice of health professionals as advocates for climate change. And this is beyond the health system. So this is really for whole economy action on mitigation and adaptation, and really pushing forward the health arguments for that. And this was launched on the 6th of September, and we'll have a very there'll be a lot of work going on this over the coming weeks and months in the run up to COP. But as that comes out, I'd really implore upon you to take some of those messaging and some of those lines and really push those forward within your own countries as well. And then the final area is around adaptation health research. So we're working with something called an initiative called the Adaptation Research Alliance, which is another COP26 initiative. And this recognizes that we need to see a shift towards research on adaptation. And this has been a neglected area. And particularly within health, we know that this is a big gap, and we know this because we commission out a systematic review to our partners in the London School of Hygiene and Tropical Medicine and the University of Leeds, which used a really innovative technique around machine learning to look at the state of climate and health research. There were many gaps within that, as you can imagine, but one of the really big gaps was around health adaptation research. And particularly within that, what are the interventions which actually help to protect the health of a population in the face of the risk from climate change? So we're supporting the Adaptation Research Alliance and really promoting for countries and their institutions to sign up to the principles behind that initiative. We're also supporting the Adaptation Research Alliance on to develop a global health research agenda on developing climate resilient health systems, which we hope to launch at COP26.
Thank you, Dave.
So very final point, Ian. I would just say that, yeah, I'd say it's really about action at this point, and so I really want you to take forward the idea that actually this is really about how it is we lead at the country level going forward, and we've lots of reasons to be optimistic. We know already, whilst only 50% of countries have a health national adaptation plan, 50% of countries do, and there's a lot of knowledge and understanding and technical guidance and support that is available. And we know also that other countries are really taking the lead on this. We talk about NHS England and its commitments, but also we're seeing that same commitment coming through from other countries. So please come away from this and think about how it is you can support these initiatives as you move forward. Thanks very much, Ian.
Thank you, Dave. I think that we will be watching COP26, and of course the encouragement that you've given in terms of the actions for many of those who are here today, and of course for them to bring that message back to their governments, to their ministries, is really important. I'd now like to take the opportunity to highlight that this next session will be an interactive conversation with member states and stakeholders. And I'm very pleased to have an excellent panel of speakers who will come to join me to talk through some of the initiatives that are ongoing. So in the first instance, so this panel will comprise Dr. Anna Babette-Stier, Dr. Teodora Grinkarowska, Ms. Caroline Paul, and Dr. Esther Putman. And in this session, what I'd also like to mention as well, for those who are either in the Zoom chat or who are watching the live stream, to also tweet any questions or kind of responses or feelings that you have, and we may be able to find a bit of time afterwards to respond to those. So in the first instance, I'd like to ask explain, we have this panel from across Europe, and to draw their perspectives. In the first instance, Dr. Anna Babette-Stier, who comes from the Federal Ministry of Health in Germany. And the question I'd like to pose to you is, for the health sector to take responsibility for action on climate change, institutional arrangements need to be supportive. And can you explain what approaches the German Federal Ministry of Health has taken in this regard of being supportive?
Thank you very much, Ian, and dear colleagues, good morning from Berlin, and thank you very much for the invitation today. As has been said previously, the EU aims to be climate neutral by 2050, and the Green Deal impacts also the healthcare sector in Europe. Therefore, I'd like to state at the very first beginning, I'm glad about the UK initiative to put health high on the agenda for COP26, because we feel that the subject needs a strong focus. And thank you, Dave. It's very impressive what the NHS does in the UK and can be a role model in many respects. Well, in Germany, only recently, we have raised the climate target to reach climate neutrality already by 2045. And this, interestingly, was triggered by a constitutional court ruling that stated very clearly you have to be more ambitious and take further steps to achieve intergenerational equity. And you cannot leave the job to future generations. So, as all of you know, we have elections in a week's time, but almost every party puts climate change very high on the agenda. So the new government is perceived to put a strong emphasis on these topics and health as well. Therefore, it was timely and consistent that we have strengthened our expertise within the German Ministry of Health itself. In 2020, the minister has established a directorate putting a focus on environment, climate change, and health. So we have dealt with the topic before, and the Ministry of Environment has, but now we have a really institutionalized part of our ministry. And this is an expression of our minister's conviction that global climate change is one of the greatest challenges and will regain prior importance after having tackled the COVID-19 crisis, which I believe put a lot of stress on all ministries of health at the moment throughout the world. So, but nevertheless, it's really timely and important that we focus on climate change in the future. Many professionals working within the health sector are highly motivated to initiate change. And as we have seen from a lot of discussions we had with stakeholders, they see the urgent need to act as a society, but it seems hard to define one's own contribution within a given institution to tackle climate change. And this is where we see our major role for the moment, to pave the path for all relevant actors, individuals and organizations to walk the talk in climate change matters. So firstly, our aim is to enable these change agents as has been said before. So there's a high credibility for doctors, nurses, and people working in the health sector. We want to enable these change agents and the health sector to considerably contribute to tackling the climate change, integrate climate change issues in the health system and make them a routine rather than an add-on. I want to mention that the community level is very important in this respect, but I'm sure we will touch upon that later when we hear about the heat health management in France. But therefore, we need to strengthen scientific evidence on the effects of climate change in human health and to improve knowledge transfer between academia and professionals working in the field, especially empowering our public health institute to play a major role, which is the Robert Koch Institute. Some of you might know. In this respect, as has been said before, foresight and preparedness play a major role to anticipate and encounter health threats, such as vector-borne diseases and heat. And we believe that there's room for more international cooperation to pool evidence and for more cooperation, which is true for improving practices to save resources as well in the mitigation process. So I'm sure we can do better in that respect. This calls for another mindset. Often we are talking about health and all policies, but it's vice versa for climate change. And so now we from the health side have to do our homework and include systemic thinking and solutions in our processes. So to achieve that, we want to strengthen the One Health principle and transdisciplinary cooperation. And I'd like to echo the WHO paper on climate change and mitigation, which we have published. One Health is a team sport. And governmental structures might not always address these needs adequately. So we're working on that, and we'll work on that for the future, for the next period, election period. But it's very important that we bring together all these different actors and perspectives
Yes.
and to make this a living principle. So, so climate change is a scientific fact. But it needs political action and leadership for the transformation, nationally and internationally. And climate change is our reality. So people have experienced the effects of climate change, as Dr. Hans Klug has said before. And now we have to make it a whole of government approach and to raise awareness in everyday life. This is why we put a platform to foster that. Last sentence.
Wonderful.
After all, we have to convince everyone that where sustainability is held high, health has the greatest impact, and this must be our aim. Thank you very much.
Wonderful. Thank you, Anna. This is really important to hear how that institutional capacity building and empowerment across the health professionals are being done at such a high level, and that support coming forward. So I'm really keen, and will be looking, of course, forward to seeing those actions roll out across Germany. So really appreciate that time. I'd now like to take the opportunity to introduce Dr. Teodora Abradovic-Ranakarowska, and from the Ministry of Environment and Physical Planning in North Macedonia. So the question that I'd have for you is, your ministry is integrating climate action into energy policy planning to create a low carbon and more resilient society. Can you explain what measures that North Macedonia has taken to assess the co-benefits, including health benefits, of these climate change mitigation policies? Oh, I think you may be muted.
Good morning, everyone. Thank you for the opportunity to take part on this debate and to exchange our experience from the North Macedonia. As has been already mentioned, the Republic of North Macedonia signed the Sofia Declaration on Western Balkan Green Agenda in November 2020 as part of the Berlin process to address
Maybe that we have a slight connection issue. I'll just wait for a second to see if it resolves. But perhaps if in the meantime, we might give Teodora the opportunity to speak afterwards. in which case I will then come back to Theodora when the connection is on. But in the meantime, I'd like to introduce Dr. Esther Putman from the Ministry of Public Health and Sports in the Netherlands. And for you, what I'd like to ask is, in the Netherlands, you use a Green Deal approach toward climate smart and environmentally sustainable health systems. And I think that's really interesting. And what I want to ask was, what's the main driver to initiate such a process towards sustainable healthcare using that approach?
Well, thank you, Ian, for that question. The main driver, I would say, is the motivation within the healthcare sector to become more sustainable. And we as a ministry could facilitate and help and support these ambitions with the Green Deal. And actually, a couple of things happened in 2018 that made it possible to start this process. One is, of course, the Ostrava Declaration, which has sustainable and resilient healthcare system in it. And the other is the Climate Act of the Dutch government. The Dutch government has committed to reduce its CO2 emissions to net zero by 2050 in order to meet the Paris Climate Agreement. And the things that directly affect the healthcare system are an action plan to reduce the emissions of the built environment, to reduce the emissions of the transportation sector, and to have the energy transition completed by 2050. And to top these up with healthcare specific issues, we set up this Green Deal Sustainable Healthcare for a Healthy Future. We did this together with the sector, and the aim is to accelerate the sustainability of the healthcare sector. So besides working on CO2 emission reduction, which is covered by the Climate Act, we also focus on the reduction of the use of raw materials, so more circularity in the healthcare sector. We focus on reducing the reuse of medical residues in surface water, and we focus on a health promoting care environment. So why does the healthcare sector want to work on sustainability? Well, we see a very high level of awareness within the healthcare sector of the effects of climate change on our health. And this is, of course, super ironical for people working in the healthcare sector because they try to cure people. And by doing so, they contribute to climate change. Alone in the Netherlands, the sector is responsible for 7% of the national CO2 budget. Worldwide, it's 5.5%, as we've already heard today. So the health sector contributes to climate change. Climate change negatively affects our health, making people ill, so they may need more healthcare. And this will increase healthcare's contribution to climate change. So we get into this downward spiral. And this is, of course, in contradiction to the objectives and goals of people working in healthcare. So they want to put a stop to it, and they want to do something about this. And we see that this high awareness leads to action. And we see this action actually across all age groups within the healthcare sector and the auxiliary sectors. And that is why we are very glad to see, and I can say on behalf of our over 250 Green Deal partners, that we are very glad to see that the UK COP presidency is putting the relationship between climate change and health and the importance of climate sustainable and resilient healthcare systems so high on the agenda, asking ministers all over the world to commit to this. So to briefly summarize, climate change affects our health, the sector has to deal with these effects, and on the other hand, the healthcare sector contributes to climate change. And to stop this, the healthcare sector should become more environmentally sustainable, reduce its CO2 emissions, its greenhouse gas emissions, its consumptions of natural resources, and become more resilient. The healthcare sector can lead by example and highlight the importance of climate action to protect our health. Thank you.
Thank you, Esther. And thank you also. That point of leading by example, I think, in the healthcare system is so important. And I'm really looking forward to see that roll out across the Netherlands and as an exemplar for others to take note. To go back now to Theodora, apologies that we did get cut off. And I'd like to take the opportunity now to ask you to respond to the question I posed, which was around that implication in terms of co-benefits and how it was that you assessed that as a part of your planning in decarbonizing. Thank you, Theodora.
Thank you, Jan. As I already started, we as a country has signed the Sofia Declaration on Western Balkan Green Agenda in November 2020 as part of the Berlin process to address decarbonization, depollution, circular economy, biodiversity, etc. Given its European perspective and commitments to align with the evolving EU acquis, as well as 2030 Agenda and the Paris Agreement. It will require actions and development of a new approach that will ensure mainstreaming of green and sustainability elements into all policy areas. In my personal view, we have achieved an excellent mainstreaming on climate action into the energy policy planning, leading towards decarbonized and more resilient society. We have developed and adopted necessary strategic and planning framework and set a pathway towards less carbon-intensive and more resilient future by adopting the energy strategy, long-term strategy on climate action with the action plan, enhanced national midterm contributions, and other strategic and planning documents. And we are finalizing legislative framework on climate action too. Our decarbonized pathway is clear. More usage of renewable energy sources plus intensive energy efficiency, including energy efficiency in health sector, phasing out of coal, gas for combined heat and power, electricity, heat and transport sector coupling, and district heating plus heat pumps. Our targets are set in 2030, 51% reduction in greenhouse gas emission compared to 1990 level, and 42% by 2050 compared to 1990 level, excluding emissions from aviation and forestry and other land uses, and increased resilience of North Macedonian society, economy, and ecosystems to the impact of climate change. We have shown that 70% of reduction on greenhouse gas emissions can be achieved by negative and so-called win-win types of policies and measures, which are 2/3 of all proposed policies and measures and would bring new jobs, around approximately 10,000 by 2035. As to the health sector, into our long-term strategy on climate action, we are addressing this sector as a vulnerable to the climate change with critical need for adaptation measures. The health sector will be one of the leading targeted sector in our national adaptation plan, with particular focus on building a solid system for the regular and periodic collection of air, climate, health-related data. Last but not least, I would like to mention the ongoing activity aimed at calculation of health co-benefits associated with the improvements of ambient air quality that could be expected from the implementation of a national action plan to curb carbon emissions as proposed in our latest national midterm contribution. For this purpose, the national mitigation team of our academy, together with WHO experts, make use of carbon reduction benefits on health tool, which was developed by WHO, launched in December 2018. We are very glad to be among the first countries undertaking this exercise and are eager to see the quantified physical and economic consequences for human health and of improvements in country level air quality from domestic carbon reductions. That will definitely be an extra push on our decarbonized pathway. Thank you.
Thank you, Theodora. That's really wonderful to hear of those use of such tools in the public forum and to be able to guide policy. I'd like to take the opportunity now, and I'm afraid we don't have a lot of time, but it's going to be very interesting to hear from Ms. Carolyn Paul from the Ministry for Solidarity and Health in France. The question I have for you, if we can cover briefly, is with the French government committing to tackling climate change through adaptation and mitigation measures, in this context, how has the Ministry of Health supported the health sector in strengthening adaptive capacity and climate resilience, and in particular in the management of heat and health, an issue which I know you'll be able to speak to. So briefly, Carolyn, if we may, tell us about the French situation.
Okay, good morning, dear colleagues. Yes, first, can I give you some information of the global context and the last evolution in France concerning climate change? So the government has recently made the fight against climate change part of the field of action of numerous ministries, such as environment, of course, agriculture, economy, and etc., and also health. And the government asked ministers to involve themselves into mitigation and adaptation action planning. For the health ministry, the first objective is to engage all relevant stakeholders in the sanitary field. We evaluated that the hospital and medical social sector is responsible for about 5% of the emissions of greenhouse gases. Structure of the health sector, especially health and social medical facilities, need to take strong climate mitigation action, and in the same time have to be more sustainable and resilient. Our economic recovery plan supports investment in the equipment and technical system of hospitals. Specific measures also make it possible to improve thermal comfort and achieve a better response during climatic episodes such as heat waves or cold spells. The renovation or construction of buildings, including an energetical renovation with renewables, is also supported by the funding of the recovery plan. Moreover, energy counselors will be sent to the regions to support the facilities in reducing energy consumption. In a broader context, we need to promote the exemplary practices already adopted by some facilities. The global mobilization of the health sector to fight climate change is part of the goals that France will pursue at COP26 in November. On the other hand, we will develop a set of actions to adapt to climate change. It concerns vector-borne disease, invading species, water resources, resilience of the health system, and in particular, the Ministry of Health drives the preparation of a revised specific health action plan in coordination with the Environment Ministry in order to protect and preserve the health of vulnerable population in case of heat waves. This plan will build on the experience of France in the management of extreme heat waves and propose multi-sectoral action to adapt to a warmer climate, covering the diversity of exposure situation at school, at work, etc., and individual susceptibility, age, underlying health condition. It will consider both the short-term response, stroke warnings, communication, and temporary change in behavior and organization to a long-term structural adaptation to it through housing, urban planning, systemic organization change. It also designing new communication tools complementing those already in place, and in case of extreme heat wave, restriction of some activities. For example, examinations in school, sporting or cultural events, adaptation of the working hours, and so. And simultaneously, we will need to strengthen the alert and surveillance system to protect the population, including workers. This work is in progress. And the Public Health Agency, Santé Publique France, is notably in charge of the task and re-evaluate on the regular basis the health risk due to climate change, makes a link between environmental and climate surveillance data and the health and epidemiological knowledge, elaborate advocacies, of course, and contribute to strengthening the role of National Public Health Institute in climate action through advocacy, capacity building, and peer-to-peer exchange within the international network, YANFI.
Thank you. Ms. Kerr, this is wonderful to hear, and I appreciate that France is doing so much now to be able to tackle this issue more broadly and build that resilience in the healthcare system. And I thank you very much for your intervention today. As we're short on time, I'm going to now move to a few statements from the floor as well. And to first thank you, all of the panel members today to join us. And we've heard a great deal of the actions that are being undertaken across the member states. And so the audience to say thank you to those. I'd like to now invite Mr. Peter Loeffler from the European Commission for climate action to make a very short statement. Peter, the floor is yours. Perhaps Peter is not here at that moment, in which case I might, oh, no, he is. I just see him, he's just unmuted. Needs to be unmuted.
Okay, good. I was just allowed to speak, and thank you very much, Ian. Good morning to everyone, and many thanks for giving us the floor today. I'd like to use my short time to convey basically two messages. My first message is one of full support for WHO's health and climate agenda. The European Green Deal already addresses climate and biodiversity together, but we still need to do more to bring health fully into the picture of that. Here, the good news is, of course, that Europe's move to climate neutrality promises already significant health benefits, as it's been said. The bad news is that the climate crisis still will be unavoidable, and we expect it to be a major public health threat. We therefore must send a strong signal about the need to better connect the climate and health policy agendas and to drive a green, healthy, and resilient recovery from COVID-19, and we count on everyone's support for that. My second message is a call for continued cooperation and collaboration. EU policies and programs do give growing attention to climate health, and notably, as Hans Grunick already mentioned, we launched earlier this year the European Climate and Health Observatory. EU member states have reacted very positively to this initiative, which is good. We were also extremely pleased that WHO Europe joined it as a partner alongside the Lancet Countdown and other major players in the field. And we therefore really look forward to continued collaboration with WHO Europe and the other partners on this very important policy initiatives, because we think it is concrete initiatives like this one which give us the hope that by working together we have a chance of weathering the climate change, the climate health challenge. Many thanks for your attention, and back to you, Ian.
Thank you very much, Peter. I appreciate those points made. I would like to now invite Mr. John McCauley from the UNDP Regional Hub also to make a short statement. John, thank you.
Thank you so much. Good morning, Regional Director, distinguished delegates and colleagues, and thank you, Ian. It's an honor to connect today to say a few words about our important collaboration with WHO and the joint value proposition paper that we've put together on health and climate in Eastern Europe and Central Asia. As you know, both of our organizations prioritize approaches that focus on developing integrated multi-sectoral climate change strategies, including health components, addressing climate resilient health systems and comprehensive adaptation initiatives, creating improved climate information, and finally, building climate resilient energy and infrastructure. All of this is reinforced by the fact that both of our organizations bring together to the table diverse expertise and solutions, which is also embedded in the memorandum of understanding, which was signed by the two organizations in 2018. Also, I would like to emphasize some key entry points to enhance national determined contributions and national action plans through health mainstreaming, which include, for example, UNDP's climate promise initiatives across countries in the region, capitalizing on health and economic co-benefits while addressing air pollution, which has been many times highlighted today already by the speakers, promoting digital forecasting of infectious diseases in the context of climate, and also quite important for UNDP, also supporting sustainable health procurement, as this allows us to demonstrate that we practice what we preach as key as organizations that procure and countries that procure health commodities. So just to say that all of this work and the discussion that we've had around the value proposition has culminated in us working together on the regional vulnerability baseline assessment. and developing a joint GCF proposal, which will include a number of countries across the region, including potentially Armenia, Moldova, Turkmenistan, and Uzbekistan. So I think I would like to thank you again all for your attention. And I would like to reiterate UNDP's commitment to work closely with WHO and partners on the climate and health nexus, as it is an important game changer moving forward. So thank you very much, Ian, and handing back over to you.
Thank you very much, John. It's great to hear of those initiatives, and especially the wider context for across Europe and its partners nearby. I'd also then like to take the opportunity to invite Dr. Jenny Miller from the Global Climate and Health Alliance to also now make a short statement. Jenny, please.
Thank you, Ian. There's no question our health systems risk the impacts of climate change, and it's, of course, vitally important that we make them resilient. And we can also show health sector leadership on the climate crisis by decarbonizing the health sector. In addition, as Dave McConnell mentioned, concerned health professionals and health organizations are raising our voices to call for climate action across sectors. In a survey of members of health professional associations from across the world, we found that 90% of participating doctors and nurses feel that health professionals have a responsibility to bring the health effects of climate change to the attention of policymakers and to push national leaders to strengthen their climate commitments under the Paris Agreement. In the run-up to COP, health groups from around the world are acting on that concern with a call to national heads of state and to each country's lead COP negotiator for urgent, equitable action that will limit warming to 1.5 degrees, provide financing, and support adaptation. A letter with that message is being signed on now, and it will be sent to national climate negotiators in October, and then will be delivered in person during COP26. So health leadership can be powerfully influential, and the health movement urging ambitious action on climate change is really just growing by the day.
Thank you very much, Jenny. That's really wonderful to hear. And I say the message that's going to be brought through that letter, I think, is very powerful, coming from all the organizations signing on. I'd like to take the opportunity now, just very briefly, to invite Mr. Scott Brady, Healthcare Without Harm, also now to make a short statement. Thank you.
Thank you, Ian, and thank you for having me today. So COP26 represents a huge opportunity to drive forward global ambition on protecting health and reducing emissions, strengthening resilience and adapting to climate change. Healthcare Without Harm offers a range of opportunities to support governments and healthcare providers in reaching those ambitions. So I wanted to summarise 4 of those in particular today. And firstly, in April, we published our global roadmap for healthcare decarbonisation, which demonstrates a viable and equitable route to zero emissions from healthcare. And then secondly, as we've already heard from Dave McConnell, Healthcare Without Harm is partnered with the COP26 presidency, WHO and the UNFCCC climate champions to engage countries and stakeholders in 2 key initiatives. So that's the Climate Resilient Health Systems Initiative and the Low Carbon Sustainable Health Systems Initiative. And then thirdly, through our Operation Zero project, we've partnered with 4 national and regional health authorities, including the Dutch government, to develop and pilot a methodology to measure healthcare emissions and develop a Paris-compatible decarbonisation roadmap. And then fourthly, we've partnered with the UNFCCC under the Race to Zero banner to encourage healthcare providers to declare their climate ambitions and join the Race to Zero. So I guess the take home from this, achieving climate smart healthcare can often sound very daunting. But it is achievable and support is out there to help achieve that. So if you are interested in finding out more about any of these initiatives, then please do get in touch. So thank you.
Thank you very much, Scott. And I really appreciate hearing about those initiatives as well. And I think the group, all of what we've heard today is going to be incredibly important for taking those actions into health system, into the ministries, to those responsible, but also, as what was just reflected on it from both Jenny and Scott, was that there's the groundswell of practitioners who want to see change and coordinate that. And so I think that this is a really important activity as we've gone through today. We're going to now move towards the closing. We didn't have enough time, and I must say I so greatly appreciate all of the speakers today who have done their very best in keeping us on track and to be able to cover such a wide range. and to hear from the very beginning, the setting the scene of the importance of this to WHO Europe, across the European Environment Agency and Commission, the case for the implications of climate change on health from Andy Haynes, the opportunities that will come forward from COP26, and then to hear through the different ministries of those actions that are being undertaken in direct support, so ensuring that our health systems are resilient to climate change, but also do more than that, are protective of our health going forward and support that one health and overall the planetary health angle. I'd like to take the opportunity now to invite Carina Ferreira Borges, Acting Director for Non-Communicable Diseases, Division of Country Health Program, for a closing remark and the take-home messages. Carina, the floor is yours.
Thank you very much, Jan. Thank you for giving me the floor. And as you mentioned, I will be doing this closing statement on behalf of our Regional Director, Dr. Hans Klug. So this has been a very timely event, considering the urgency of bringing climate change on the health agenda, and also in light of the preparations for the COP26. We are proud that such an important debate has been featured so prominently in the Regional Committee for Europe. A big thank you to all of the speakers and also for your invaluable contributions. And of course to you, Jan, in particular, for the great moderation, for keeping everybody on time. And we know that this has been an exemplary cooperation with the Lancet and our office. Also a big thank you, because we know that you've been up. This is like around 2 or 3 a.m. in your time in Canada. So it's a very early start in this morning. Thank you for being there. None of us can ignore the relationship between health and climate change, and it is our duty to spread the message. Climate change is our reality. This has been said over and over by all of the participants in this discussion. We have heard about international efforts from our EU colleagues, as well as inspiring and groundbreaking national examples. This came from Germany, mobilizing its health sector as a change agent, North Macedonia and the Netherlands setting emission reduction targets justified by health co-benefits, and France Public Health Agency leading the efforts to protect their population from the effects of climate change. These are just a handful examples of activities going on across our region to mitigate and adapt to climate change. Although countless initiatives are now going underway, we are still needing to double down our efforts. We have heard this today here. The COP26 health program is a call to action to all of us, and for us to also lead by example. Let's show our ambition, let's show our leadership by committing to its initiatives and by signing up to it. Let's make all ministries of health agents for change, engaged in preparing for and in participating in the COP26. Let's strengthen the voice of the health sector on climate action, and together we will be heard. Thank you very much.